Okay, good morning. Bonjour et merci de vous être joints à nous aujourd'hui. This week is Mental Health Week. I know the past weeks have been difficult for everyone. Let's remember to take care of ourselves and of each other. Let's remember that it's okay to ask for help and to feel sad and frustrated and alone. We are all in this together. And while we do need to practice physical distancing, we don't have to suffer alone. There is help out there for all of us. À tous les Canadiens, je sais que c'est un temps très difficile. En l'honneur de la semaine de la santé mentale, rappelons-nous qu'il faut prendre soin de soi. Rappelons-nous qu'on peut demander de l'aide et que c'est correct de se sentir triste ou seul. Nous allons en sortir ensemble. Personne ne devrait souffrir dans l'isolement. So today we are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Njoo, et le Président du Conseil du Trésor, Jean-Yves Duclos. Dr. Tam, please.
Good afternoon. Bonjour à toutes et à tous. I will start with the latest numbers on COVID-19 in Canada. There are now 59,844 confirmed cases, including 3,766 deaths. To date, labs across Canada have tested over 919,000 people for COVID-19, with just over 6.5% of these testing positive. We are at the start of a new week as we all inch closer to social and economic reopening. Most of us will be feeling the full gamut of emotions, from excited anticipation to nervous apprehension. All of these feelings are warranted, given the uncertainties that lay ahead. Still, there are continued signs that our efforts have slowed the growth of COVID-19 overall in Canada. In some places, the epidemic has been brought under good control, and the time is right for a cautious reopening. Other areas of the country may not be quite there yet, but will follow, guided by the careful assessment of public health authorities. During these many weeks, public health tools have helped us to tackle COVID-19 spread, buying us time to protect and bolster our healthcare capacity, ramp up research, and increase capacity for testing and tracing. Going forward, adapting these tools will be a big part of managing COVID-19 for the months ahead. No matter where we live, living with COVID-19 is something we all need to reconcile with. This means physical distancing, hand hygiene, and cough etiquette must continue everywhere. And although we'll be getting out of our homes more and more, it will be vitally important that at the slightest sign of symptoms, we stay home to save lives. Working while sick can no longer be a thing. As we move through the weeks ahead, let's not forget we are all in this together, and we'll work our way through it with good science, strong evidence, careful steps, and a shared goal to succeed despite the hardships. Together, we can do hard things. Today is May the 4th, so may the force be with us. Que la force soit avec nous. Thank you.
Thank you, Dr. Tam. Dr. Njoo, please.
Merci. Bon après-midi. Comme d'habitude, je commencerai par faire le point sur le nombre de cas de COVID-19 au Canada. On dénombre actuellement 59 844 cas confirmés, dont 3 766 décès. À ce jour, les laboratoires au Canada ont effectué plus de 919 000 tests de dépistage pour la COVID-19 et plus de 6,5% d'entre eux se sont révélés positifs. Nous entamons une nouvelle semaine et à mesure que nous nous approchons peu à peu d'une reprise des activités sociales et économiques, la majorité d'entre nous passera par toute une gamme d'émotions, à partir d'une grande impatience jusqu'à de l'inquiétude. Toutes ces émotions sont justifiées étant donné l'incertitude qui nous attend. Néanmoins, nous continuons de voir des signes que nos efforts ont permis de ralentir dans l'ensemble la progression de la COVID-19 au Canada. À certains endroits, l'épidémie a été bien maîtrisée et le moment est venu de procéder à une réouverture prudente. D'autres régions du pays ne sont peut-être pas encore tout à fait prêtes, mais elles le seront prochainement guidées par l'évaluation minutieuse des autorités de santé publique. Au cours des dernières semaines, les outils de santé publique nous ont aidés à freiner la propagation de la COVID-19, ce qui nous a donné le temps de protéger et de renforcer notre capacité en soins de santé, d'accélérer la recherche et d'accroître la capacité de dépistage et de recherche de contacts. Pour les mois à venir, l'adaptation de ces outils occupera une place importante dans la gestion de la COVID-19. Peu importe où nous nous trouvons, nous allons devoir nous faire à l'idée que la COVID-19 va faire partie de notre vie. Cela signifie qu'il faut continuer de suivre les mesures en ce qui concerne l'éloignement physique, l'hygiène des mains et la manière de tousser partout où nous allons. Et même si nous allons sortir de plus en plus, il sera crucial de rester à la maison pour sauver des vies si nous présentons le moindre symptôme. Il est désormais hors de question d'aller travailler tout en étant malade. Au cours des prochaines semaines, n'oublions pas que nous sommes tous dans le même bateau et que nous allons nous en sortir grâce à des données scientifiques fiables, à des données probantes solides, à des mesures prudentes et à notre désir commun de réussir malgré les épreuves. Ensemble, nous pouvons faire des choses difficiles. Et que la force soit avec nous. May the fourth be with us. Merci.
Merci, Dr. Njoo. Et maintenant, je donne la parole à Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Chrystia, et bonjour tout le monde. Nous faisons, comme nous le savons, face à une pandémie mondiale qui demande une réaction mondiale en termes de santé, mais aussi en termes de solidarité. Et c'est pour ça que ce matin, le premier ministre Trudeau a fait une annonce importante pour que le Canada continue de jouer un rôle important sur la scène internationale, malgré les enjeux auxquels nous travaillons très fort sur la scène nationale. Il s'agit d'une annonce de 850 millions de dollars pour appuyer le dépistage, le traitement et la vaccination contre la COVID-19, de manière à se préparer au développement, à la production et à la distribution de produits et de traitements et de vaccins qui pourront nous protéger et qui pourront guérir la COVID-19. As we know, this is a very important health crisis at the international level, and that's why we also reacted, as we saw this morning with the Prime Minister, nationally and internationally. And with the health crisis has also come an economic crisis, and I would like briefly to summarize a few of the emergency response statistics that we have seen over the last few days. First, when it comes to helping workers through the Canada Emergency Response Benefit, a total of 7.3 million Canadians have received the CERB for a total of 10.6 million applications. Second, when it comes to providing help for wage subsidies, emergency wage subsidies, as of the 3rd of May, 96,000 applications have been made on the part of businesses, and a total of 1.7 million workers are being helped through the emergency wage subsidies. And finally, to help support our small businesses in this very difficult time, through the Canada Emergency Business Account, 518,000 businesses have applied and have received a positive response following their applications for the emergency business account, helping them go through the crisis in order that when the crisis is over, we can still rely on the great level of leadership and ability of our small businesses to grow again the economy. Thank you, Chrystia.
OK. Merci, Jean-Yves. Et on est maintenant prêt à répondre à vos questions. And obviously, our Minister of Health, Patty Hajdu, is here to answer questions as well. Carl, s'il vous plaît.
Thank you, Deputy Prime Minister. As usual, we'll start on the phone with 3 questions before we turn to the room. 1 question, 1 follow-up. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. We have a question from Laura Osmond from the Canadian Press. Please go ahead. The line is now open.
Good morning, ministers. For anyone who's able to answer, the Chinese embassy says the million masks from China that the Public Health Agency said couldn't be distributed last week were held up by a contractual dispute, and it's been resolved. Are you able to elaborate at all on what happened and what the status of those masks is now?
Hi, we'll have to get details back to you. I'm sorry, we don't have that technical information right now.
Laura, follow up?
Deputy Prime Minister Freeland, I was wondering if I could ask you a more political question. I'm wondering to what extent you're concerned about the rhetoric coming from your policy rivals, the Conservatives, and their refusal to express their confidence in the nation's top doctors.
Well, first of all, let me be clear about one thing, which is that to ever impugn the loyalty to Canada of a Canadian based on their racial or ethnic background or whether they were born in this country or immigrated here is completely unacceptable. A Canadian is a Canadian is a Canadian. And I am so confident that the overwhelming majority of Canadians understand and believe that. When it comes to the public health officers in Ottawa and across the country, I think Canada has been very well served by the dedication and the expertise and the collaboration of our public health officers across the country. And I think political leaders across the country have been really uniform in spending a lot of time with our public health officers, really working hard to understand their advice and to listen to their advice. And I think that has served Canada and Canadians very well.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de l'inaudible de la presse canadienne. La parole est à vous.
Oui, bonjour, Monsieur Duclos. C'est à propos de vos chiffres que vous venez de nous donner qui sont fort intéressants. Donc, j'aimerais savoir les 7,3 millions de PCU sur les 10,6. Est-ce que c'est parce qu'on n'a pas encore traité toutes les demandes ou est-ce que ça a été des refus? Et le 1,7 million de travailleurs donc, qui peuvent bénéficier de la subvention salariale, est-ce que ce sont des gens qui ont délaissé la PCU pour y aller ou non, c'est d'autres? Parce que j'essaie encore une fois d'évaluer si votre objectif de départ, qui était de transférer les gens de la PCU à la subvention salariale, est en train de fonctionner.
Très bien, merci beaucoup. Alors, première réponse à la première question. Au sujet de la prestation canadienne d'urgence, un total donc de 7,3 millions de Canadiens ont fait une ou deux demandes. Une ou deux parce que le total de demandes est de 10,6 millions. Et de demandes acceptées, à peu près toutes les demandes qui ont été soumises, qui ont déjà été traitées. Donc, la différence entre le nombre de demandes et le nombre de personnes qui ont fait une demande, c'est le fait que certaines personnes ont reçu plus qu'un paiement. Et la raison étant que, à partir du 6, en fait, c'était plutôt le 11 avril dernier, les Canadiens pouvaient faire une nouvelle demande, en plus de celle qu'ils auraient pu avoir déposée pour le premier mois. Pour la subvention salariale d'urgence, vous avez tout à fait raison. Donc, 96 000 entreprises ont fait une demande de remboursement de salaires déjà effectués durant le premier mois, entre le 15 mars et le 11 avril. Ça couvre 1,7 million de travailleurs. Donc, 1,7 million de travailleurs qui n'ont pas eu et qui n'auront pas besoin de faire une demande pour la prestation canadienne d'urgence.
D'accord. Donc, c'est pas des gens qui ont... Oui, donc c'est pas des gens qui ont transféré de la PCU. C'est des gens qui, au départ, n'avaient pas la PCU. J'avais une autre question un peu technique sur la PCU pour étudiants qui s'en vient. Je sais que c'est pour 4 mois, mais les calendriers scolaires sont différents. Par exemple, les cégeps auraient dû finir en mai, mais ils vont finir seulement à la fin mai. Est-ce que ça veut dire que les étudiants de cégep vont seulement avoir la PCU en juin, juillet et août? De la même manière, est-ce que les étudiants des écoles secondaires qui s'en vont vers l'université vont avoir la PCUE seulement en juillet et août parce que leur année scolaire finit en juin?
Bon, pour d'abord, juste de précision pour la première élément, le premier rajout de réponse que vous avez fait. Et donc, tout dépend évidemment des circonstances des travailleurs. Donc, il ne faut pas penser là, qu'une seule situation s'applique à tous les travailleurs. Donc, certains travailleurs pourraient, par exemple, avoir reçu un paiement de prestations canadiennes d'urgence et là, s'être aperçu que l'entreprise pour laquelle ils travaillaient leur versait des subventions, des salaires d'urgence. Donc, il peut y avoir des travailleurs qui ont remboursé déjà ou qui vont rembourser prochainement leur versement de prestations parce qu'ils ont reçu des salaires d'urgence de la part de leur entreprise. Pour la prestation canadienne d'urgence pour les étudiants, le moment important, c'est le moment auquel ils terminent leurs études pour pouvoir, comme ils le feraient normalement, penser à trouver un emploi. Donc, pour les étudiants du cégep au Québec, c'est un peu différent parce qu'on n'a pas de cégep en dehors du Québec. Donc, c'est à partir du moment où ils terminent leurs études et qu'ils se chercheraient un emploi, c'est à ce moment-là qu'ils deviennent, évidemment, sujets à certaines conditions, admissibles à la prestation canadienne d'urgence pour les étudiants. Pour les étudiants, les élèves du secondaire qui terminent et qui ont l'intention de poursuivre des études postsecondaires, bien, c'est comme pour les autres étudiants en dehors du Québec, c'est à partir généralement de la fin du mois de juin. Et pour les étudiants universitaires, bien, c'est à partir du début du mois de mai, comme pour tous les étudiants au Québec ou ailleurs.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from Lauren Gardner from Politico. Please go ahead. The line is now open.
Thanks. This question is for Dr. Tam. You've talked a lot about the need for Canada to ramp up testing to 60,000 a day. And I'm wondering when you think that Canada can get to that point and what, until then, what needs to be done to get there?
I think there's increased testing, as you've seen, day over day. So I think the common goal is to increase that. 60,000 is just the capacity target for the province and territories based on the existing public health laboratory capacity. But we're investigating any other avenue for increasing lab testing, including point of care, and also the role of serologic testing when they do come on board. I think it's not a magic number. That is a capacity number. You do have to test the right people at the right place at the right time according to the epidemiology of the provinces. So they have to adapt their testing strategy based on what they're seeing. It's very different from a jurisdiction that have no cases and no community transmission. But there's increased testing, of course, being ramped up, for example, in Quebec, particularly in communities where there's been more reporting of cases. So I know that chief medical officers and provincial public health authorities are very seized with the need to use testing to inform the next stage. So I think we would expect to provide as much support as we can from the federal level to enable that to happen. So, but every day, as I think Ms. Hajdu will attest, we're constantly monitoring every bit of the supply chain, and every day there may be something that we need to tackle together. So that's just a sort of daily reality of the supply issue. But we're also tackling supplies from a domestic manufacturing ramp up as well. So I think a lot of those trajectories means that we can absolutely be increasing testing in Canada.
Follow-up?
Yeah, my follow-up for the Deputy Prime Minister. I'm wondering kind of what is the next stage of Canada's engagement with the U.S. on COVID-19 response, just given looking at the large caseload in the U.S. and the differences between the states on what some are doing in terms of promoting physical distancing versus moving to reopen economies, and the impact that could have on Canada as we move further along and get further away from the immediate public health response. Do you have any thoughts about what might need to change in terms of Canada's collaboration or interactions with the U.S. on COVID?
So let me just start by commenting a little bit on the premise of the question, the idea that there would be a next stage. The reality is that the Canadian relationship with the United States is so close, and there is a connection and an interdependence on so many levels that this is a relationship that we are working on literally every day, even every hour, and not only at the federal level. The premiers are very engaged, particularly in working with the governors of their border states. Mayors are involved, business peoples are involved. So it's something that is happening every single day, every single hour, and that is exactly as it ought to be. And it's a relationship when it comes to coronavirus that has a lot of different aspects to it. There is obviously the border relationship, and I think that that is working out today very well for both countries. We have told Canadians, we've asked Canadians to stay at home, and it's been very neighborly to offer that same approach when it comes to our American neighbors. At the same time, essential travel is still happening, and that is happening really effectively. And that is so important for things like being sure that we have groceries in our grocery stores. We also have been working really effectively when it comes to the medical equipment supply chain. So this is an ongoing relationship. It is something that is a priority for any Canadian government, very much including this one. And it's going to develop as the situation with the coronavirus and on many other issues develops.
Merci, Madame la Vice-Première Ministre. We'll now turn to the room, starting with Julie Van Dusen from CBC.
Julie Van Dusen, CBC. I think it's for Theresa Tam or for Patty Hajdu. So President Trump says he believes that COVID-19 is the result of a horrible mistake in China, that he and Mike Pompeo have evidence that it originated in a Wuhan lab. What's the government's view? Where did it come from? How did it start?
Well, I'll start and I'll turn to Dr. Tam, as she's been actively involved in monitoring the illness since it first made its appearance back in December. There will be time, obviously, and a lot of interest and importance to understand how this virus became prevalent in the human species. And I think those questions are being asked, rightfully so. Certainly, the research and scientist community is all over it and trying to understand where the virus originated from and how it's evolved and mutated since it's been present in humans. But for me, as the Minister of Health, and certainly as the Government of Canada, although those questions are important because they will help us prevent future outbreaks and understand what we can learn from this particular virus. What's even more important right now is to stay focused on Canadians' health and helping Canadians get through the outbreak that we're in now, how we flatten the curve together, and how we protect and strengthen the health and social fabric of our communities. And so that's the work that I remain focused on. Dr. Tam, did you have anything further to add about your work?
Well, I don't think we've seen any specific information to say that this is a laboratory accident or release, but at the same time, we don't know the exact origins of this virus. Of course, the hypothesis is it comes from a reservoir like bats. It's very likely to have involved another animal somewhere in between the zoonotic or animal-to-human transmission. So that question hasn't actually been answered fully as yet. So I think there's a lot of work, including genetic analysis and more collection of animal and other data. There is international constructs with OIE, WHO, and others just to try and get to the bottom of the sort of where that zoonotic transmission occurs. So I think the natural history of the evolution of this virus will may be found in the upcoming months, but sometimes you actually might not find that until many months later. The SARS virus was the same thing. You had to sort of trace back, do a lot of sort of analysis in order to come up with a hypothesis. So I'm not sure that this is something that will be, immediately obvious, but work is continuing on that front.
Okay, so I didn't hear the words wet market, so it seems that it's not 100% clear where it came from. And on a similar kind of vein, it wasn't so long ago, and I guess the question is either for Theresa Tam or Patty Hajdu. It wasn't so long ago that the government said temperature taking was not reliable. There was no reason to take people's temperatures when they came into the country. That was maybe a couple of months ago. Now, Air Canada, you won't be able to get on a plane unless you have your temperature taken, you're wearing a mask. So I guess I'm wondering, do you regret being so definitive, or is it just really hard to get your footing when it comes to this virus?
Well, it's a novel virus undergoes a lot of evolution in terms of knowledge, but the more you actually understand this virus, the more you begin to know that temperature taking is not effective at all. In terms of people coming across, even if you're infected, we know that the likelihood of picking up someone who's symptomatic is sort of relatively inefficient. And so temperature screening alone is not going to add to that. And if we had a significant number of asymptomatic or pre-symptomatic people, that also even reduces even the effectiveness even more. I think the most important aspect of our current response is to ensure that incoming travelers undergo the mandatory 14-day quarantine, so that within those 14 days, if you had a temperature, if you had any other symptoms, you can be safely managed and that you reduce spread to the rest of the population. So that is really the fundamental aspect of our border health response right now.
Thank you, Dr. Mr. Chase.
Hi, Stephen Chase, Globe and Mail. My question is for the Deputy Prime Minister. In 2017, your government famously said that you would welcome people from around the world, refugees who were fleeing persecution and other dangers. As we reported today, 46 Hong Kong residents who took part, many of whom took part in the massive demonstrations that began there last year, have now submitted claims for asylum in Canada. They're citing harassment by police and police brutality, and they're citing fears of unjust prosecution. Canada has a large and lengthy history of Cantonese immigration to Canada, and I wanted to ask you, is there a place for these protesters in Canada?
Well, thank you for your question, Steve. And on specific asylum claims, that's an issue that needs to be adjudicated very carefully and very thoughtfully, certainly not via press conference. But let me say about the Hong Kong Canadians that you're quite right, that Canada has benefited hugely from the immigration of people from Hong Kong to Canada. They contribute tremendously to our society. And I think all of us are very, very glad that so many people from Hong Kong have chosen to make their home and their lives here.
Just a follow-up question. I think one of the issues that's going to be debated more and more over the next few months and years, and I don't think these 46 are certainly the end of this, is does Hong Kong's political and legal system give rise to a possibility of a serious possibility of persecution? What are your thoughts on that?
Look, when it comes to Hong Kong, Canada's position is clear and of very long standing. We have supported consistently the one country, two systems policy. I made a number of statements about that as foreign minister, and François-Philippe Champagne, our foreign minister, has continued to be clear about that. And because of the large number of Canadians who live in Hong Kong, Canada does have a particular interest in the situation there.
Thank you, Deputy Prime Minister. Kevin?
Kevin Gallagher with CTV News. This is directed at the Deputy Prime Minister, but feel free to answer because it does have some other implications for the Health Minister, perhaps Dr. Tam. There was two more cell phone towers in Quebec that were burnt down. So there's one on Friday. There's concern that it links back to a conspiracy theory that the coronavirus is spread through 5G networks. The question, though, is how has misinformation that we have seen throughout this pandemic hindered or presented a challenge to get out effective public health information to people about this outbreak?
Well, I'll start, and then my colleagues may want to chip in as well. The incident to which you refer is, of course, regrettable, and there have been similar incidents in other countries, too. Of course, misinformation is especially dangerous at a time like this, when all of us are concerned, quite rightly, and when all of us are being asked to radically change our behaviors and radically change the way our daily lives operate. So it's a time of both heightened anxiety and tremendous change. And so disinformation can have a particularly pernicious effect. We as a government are working very hard to push back against that disinformation. I think that's why all of us are here right now. And I would like to really also recognize the very important role the provinces and public health officials in the provinces are playing in that effort. And I do also want to say, I think Canadians have been great. Canadians are really smart. Canadians are really well informed. And while inevitably there are going to be individual moments where people fall prey to disinformation, by and large, I think as a country, people are making really smart decisions. And those smart decisions, those smart, well-informed decisions are saving lives. I don't know, Patty, Theresa, do you want to add anything?
Quickly say that I think it's quite normal during a period of such uncertainty and anxiety to look for answers. I think people want to know, I keep saying this, the question I hear in many different guises is, when will all this be over? You know, how did this happen and when will all this be over? And I think they're questions that, are top of mind for Canadians as they're stuck at home, as their livelihoods have changed, as they're so many mothers that I know parenting and trying to work at the same time, fathers too. The situation has changed tremendously for people, and that uncertainty drives, I think, a quest for knowledge or a quest for understanding. How did we get here and how do we get out? And that's why we've tried so diligently, not just through press conferences, but things like making sure we have the Canada COVID-19 app, that we disseminate information through the website, that we provide transparent information, that when we don't know, we say we don't know. And when we, when we have new information, we present it quickly to the public. There is a whole field of communications called risk communications. Certainly, experts know that it's really important that you are available, for example, that you tell the truth, and that when you don't know the answer, you say you don't know the answer. And so we certainly try to continue to follow those principles so that Canadians can have confidence in our government, but also have confidence in what we keep saying, which is that we will get through this together as a country.
Just to follow up, and with provinces opening up businesses or loosening restrictions, there are concerns that as people start to get back to what would be more of a regular routine, that some of the new habits that have been picked up, physical distancing, for example, may become eroded as time goes on. So what are the main points that Canadians who are living in provinces that are starting to loosen restrictions need to keep in mind to keep themselves safe and to ensure the spread of the virus is as low as possible?
Well, I think the first thing Canadians need to remember is it's not over. It is a cautious reopening in certain provinces and certain sectors, but that the new normal will have to include new ways of living, new ways of working that will protect us in this unique and difficult time. If we, as we know, as we suspect, I would say, a large portion of Canadians haven't been exposed to COVID-19. Which means that we don't have widespread immunity across the country. And we've done a really good job as Canadians holding the line, flattening the curve, reducing that transmission rate. But the continuation of that depends on us being extremely careful in with these new permissions from public health, that we can proceed to go back to work in certain settings, that we can proceed to go back to school in certain settings, but that we will have to follow the advice and guidance of public health nonetheless. And I think for governments, what that means is we'll need to repeat and provide that information in a variety of different ways. You'll probably see a lot more Government of Canada and provincial and territorial advertising about the importance to continue to wash your hands and to stay 2 meters apart and to cover your coughs appropriately and your cough into your sleeve and to most essentially not go to work or go to school if you're sick. And I think those messages you hear Dr. Tam repeat every day, they often are not, I think, what people want to hear. They want the magic solution, but the magic solution really is all of us continuing these practices that we've adopted and become somewhat used to over the last several months. Dr. Tam, did you want to add anything?
Yeah, it is going to be difficult, but I think keep on sustaining our messages about continuing the new things that you've learned, I think, in the last few months about personal hygienic practices, definitely staying home when you're sick, and practicing physical distancing. But I think the public does have to be supported to do so as well. So for businesses, we know that the province and territories are asking for very specific plans in terms of how do you restart certain, say, non-essential businesses safely so that the customers are also nudged into doing the right thing, like, how you pace the number of people in your store or how you set things up so that people reduce the risk of transmission. Hand hygiene stations, in different places, as you've seen, I think will continue and needs to continue. But I think a lot of the creativity and the innovation that has actually occurred in the last several months, I think really needs to be capitalized. Some of the teleworking, telemedicine, and being able to access services in different ways will, I hope, continue. You need to build on the momentum of those innovations in order to help people adjust to this living with the virus. So you'll hear us in a very boring way repeating those messages again and again. Employers, of course, need to be able to support, and governments in helping people to stay home when they're sick. That is not an easy thing to do. That's probably the most difficult habit to sever. But people have to be able to do it with the support of their workplace or their schools or the environment that they are working on. And then, of course, we know about the issues that's characterize this epidemic, which consists of supporting those most vulnerable and in high-risk settings, and those must also continue as well. But I think Canadians have so far been great, and that we, with more reinforcement, they'll be able to continue to adjust and adapt. And I think it's just adapting and adjusting in a very slow way and cautious way is how public health is envisaging things. The other thing is the balance of physical and mental health and all the other dimensions as well, so that there are some habits that we may have had, which was good for us, and we diminish them. I certainly know I've exercised less, but sort of reigniting some of those preventive measures, I think, is very important.
Merci, docteur. On va maintenant retourner au téléphone pour 3 questions. Opérateur.
Merci, thank you. La prochaine question est de Émilie Bergeron de l'agence QMI. La parole est à vous.
Oui, bonjour. J'aimerais savoir au sujet de la production d'un vaccin et de l'appel à une collecte de fonds qui a été lancé aujourd'hui. Il va quand même avoir un ordre des choses au niveau de la production de vaccins. Il y a certains pays qui vont y avoir accès avant d'autres, même si on veut que tout le monde y ait accès. Il va quand même y avoir un certain ordre. Comment on va déterminer qui va y avoir accès en premier?
Merci pour la question. C'est Dr. Njoo. Je pense, avant de répondre à votre question avec l'accès, c'est important de souligner le point qu'avec la collaboration étroite à travers le monde, c'est vraiment incroyable. Tous les scientifiques, les chercheurs partout au monde, ici aussi au Canada, tout le monde continue avec la recherche, mais aussi avec un esprit de partager l'évidence scientifique, les données probantes, afin de développer un vaccin. Pour développer le vaccin, si on parle des aspects techniques, tout le monde dit que ça va durer, ça va prendre environ entre 12 et peut-être 18 mois. Et je pense que pour les scientifiques, c'est toujours avec l'esprit aussi le concept que ça va être un vaccin pour tout le monde à travers le monde. Pour les détails, comment on va avoir la production de vaccins, comment on va disséminer partout dans le monde, ça, c'est les enjeux, les questions. À ce moment, moi, personnellement, je n'ai pas les réponses, mais c'est quelque chose, c'est sûr qu'avec une bonne collaboration qui continue à travers le monde, qu'on va trouver les solutions pour assurer que tout le monde qui a besoin de vaccins, si on va réussir à développer le vaccin, vont avoir l'accès. Merci.
Émilie, en suivi?
Yes, I will go in English because maybe Minister Hajdu can answer about this. Once a vaccine will be found by a country or the other, or different countries together, there will be countries who will have means to produce a certain quantity of vaccines faster than others. So I know that we are not there yet, but how are we planning this? There will be countries that will have access to the vaccine before others. How will that be determined?
You're right. In some ways, we're not there yet, but in other ways, we're preparing to be there for when a vaccine is created. And how we do that is, as Dr. Njoo pointed out, we work together with countries so that the research is pooled and there's a collective, I suppose, shared ownership, if you will, of the findings of the research and the discovery of potential vaccine candidates. But also, we're funding a number of Canadian companies who are doing research on vaccine, like Abcelera, which was part of the conversation or the announcement today, but looking at others as well as candidates for people that will not only be able to find the vaccine, but then produce the vaccine with their partners across the country. And all of that work is very important. It is almost like a race, but a race where you want everyone to be able to cross the finish line at once. And so we know here in Canada that as long as COVID is raging out of control in another country, Canadians will not be safe. And that's why the spirit of collaboration that Dr. Njoo spoke about is so important, because yes, of course, every country wants to find a vaccine and vaccinate their citizens. But there will always be risk to every population if we don't consider the world health and the global health. And that's why I think it's so exciting to be part of an international effort, as well as the domestic support for companies and researchers that are working so hard here in Canada.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. The next question is from Jessica Murphy from BBC. Please go ahead.
Yes, hi. Thank you. I'm just wondering what you can tell me on a federal level, what's being done in terms of emergency preparedness. Obviously, we're already in flood season, as we saw with Fort Mac, but also, we're coming up on wildfire hurricane season. So what's being done amid this pandemic at the federal level for that preparedness?
That's a great question, Jessica, and it is something we are very, very focused on. Every spring, the Minister of Public Safety and Emergencies puts together a plan working with the Minister of Defense to respond to potential floods and forest fires. This year was no exception. And in fact, this year, those preparations have had the added element of a very deep appreciation that coronavirus would add a level of complexity to the response. For example, when it comes to being really thoughtful about places where people who may need to leave a place where there is flooding or a place where there is a forest fire, having places where they can go. Obviously, this period of physical distancing means that we have to be particularly thoughtful about making provision for those kinds of things. But we are very aware that flood season and then forest fire season is upon us, and have been working very hard in collaboration with the provinces to be ready.
Follow up?
Yes, thank you. I do have a quick follow-up. I know in the U.S., for example, FEMA is looking at the complexities, for example, of getting people out of hospitals during this time and getting people out of long-term care facilities and that kind of thing. I wonder if there's anything specific that's being looked at in Canada in a similar way? Any of the challenges or any things being looked at that level?
Sure, of course. I mean, the issue of what you do with housing people who may need to leave areas of flooding or forest fires is a really, really important one. And so, of course, is the issue of taking care of and moving people who are particularly vulnerable. So for sure, that's part of the planning.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. The next question is from Marie Vastel, Le Devoir. La parole est à vous.
Oui, bonjour. Ma question est pour Madame Freeland. J'aimerais revenir sur l'interdiction des armes d'assaut de style militaire que vous avez annoncé vendredi. Votre gouvernement martèle depuis des mois maintenant, en fait, que ces armes-là ne servent pas à chasser. Alors, j'aimerais savoir si vous pouvez m'expliquer pourquoi alors il faut une exemption pendant la période d'amnistie de 2 ans. Pourquoi est-ce qu'il faut une exemption pour les communautés autochtones ou les gens qui chassent pour se nourrir, dites-vous, dans vos documents là, qui présentaient l'annonce?
Merci pour la question. Et vraiment, je crois que notre annonce vendredi concernant les armes à feu est un moment historique. Concernant l'exception pour les communautés autochtones, c'est vraiment une question des droits constitutionnels des gens autochtones. Je pense que tous les Canadiens comprennent qu'on doit faire une attention spécifique aux droits des gens autochtones, incluant concernant leur droit de faire la chasse pour la subsistance. Et c'est pour cette raison qu'on a fait cette exception. Merci.
Marie, en suivi?
Oui, sur un autre sujet, toujours pour vous, Madame Freeland, s'il vous plaît. J'aimerais savoir où en sont les négociations avec les provinces pour convenir d'un bonus, si je peux dire, pour les salaires des travailleurs essentiels. Ça fait maintenant, je pense, 1 mois que vous en discutez avec les provinces. Il y a eu encore un appel avec les premiers ministres provinciaux à la fin de la semaine dernière. Ça en est rendu où? Est-ce que vous vous êtes entendus? Et si oui, pouvez-vous nous dire à partir de quand ce bonus salarial-là serait versé par Ottawa et les provinces?
Encore une bonne question. Et en principe, on a un accord entre le fédéral et les provinces que c'est une bonne chose à faire. Au niveau fédéral, nous comprenons que chaque province a ses conditions spécifiques et il y a des provinces où on a déjà donné un bonus aux gens qui font des travaux essentiels. Alors, on continue de travailler pour régler les détails, mais ça n'empêche pas les provinces d'aller en avance. Et parlant au nom du fédéral, on est là pour aider les provinces. En faisant ça, nous pensons que c'est très important pour les Canadiens, pour les gens qui font ce travail si important. Et comme tout le pays comprend, beaucoup de gens qui font ce travail ne sont pas bien payés et c'est très important de lui donner une bonus pour leur travail. Jean-Yves, est-ce que tu veux ajouter quelque chose? Non? OK.
Mais donc, il n'y a pas d'entente, si je comprends bien.
Non, je ne dirais ça. Je pense qu'il y a un accord en principe, mais pour chaque province, c'est une question de régler les détails.
Merci, Madame la Vice-Première ministre. Mike?
Hello, Dr. Tam. So what are your thoughts on provinces? Some are doing really great, some are still struggling with the virus. So what are your thoughts about the provinces reopening, the ones that are having a harder time, while the virus is still spreading around?
So I think with chief medical officers, we've established certain criteria, but they have to be applied within the context of the local epidemiology and what's going on. It's quite a complex decision, as you can imagine, balancing, of course, the fact that you need to have these cases under control. Your ICU has got to be at good capacity, but also that you have testing and contact tracing capacity in place. So it's quite complicated, and every area is going to be different. Even within a single province, you may have different situations. So that's the level of flexibility that is required, because what we don't want is to continually sort of close everything while, you know, in that particular location, it may be safe to do so. So I think that is actually important, because there are actual potential negative consequences, of course, whether it be mental health or other issues. And I think my colleagues are very seized with that aspect as well, because if you don't return certain activities to a sort of living with COVID normal, then the consequences are could be quite severe. Some of the key areas of initial reopening that they are considering, of course, is the non-urgent medical care. People getting outside, because transmission outdoors is less of a risk, but you try to maintain that 2-meter distance. So these are the kind of decisions that they're going through. But again, what I know for sure is everybody's going to be cautious about this. So slowly, carefully, see what happens, and then do the next step, I think, is a characteristic of all of the plans.
Okay, but what if once we reopen up and people become impatient with the COVID measures because now they're free, and they want to just return to normal, and they throw those measures out the window? What happens then?
As I say, the province is going to be very careful. They have quite powerful local public health laws and guidance, and what they expect businesses, schools, workplaces to do. The moment they think something isn't going right, they're going to be readjusting. You're dialing up or down some of these measures. And so depending on how your population is adjusting, they're going to have to flexibly look at, well, do we need to tighten things up again? Mainly looking at the cases and the epidemiology for sure. So, and I do know that every community and its makeup might be quite different. So a very big city like Toronto might be quite different from a very small jurisdiction. But I think at the local level, they'll be watching very carefully. They can reinstate certain measures for sure if the things are not going well.
Thank you, Doctor. Ceci met fin à la conférence de presse. Merci.